I'm honored today to share with you the details of my leadership journey and my project, a project that aims to develop a model for countries to replicate to support women healthcare workers against workplace violence. As a quick disclaimer, this presentation does not represent the official views of CDC. And before I start, I'd like to provide this content warning. This presentation does contain references to sexual, physical, and psychological violence, which may be distressing to some individuals. Violence in healthcare workers is a global public health issue. And though it affects all healthcare workers, it's particularly harmful to women who face violence and harassment not faced by their male counterparts. These global headlines show us that violence targeting healthcare workers is happening at an alarming rate, but not nearly enough countries are collecting evidence-based, gender disaggregated data that support solutions to protect these women who are the healthcare system. When healthcare workers experience violence, research has shown that it leads to burnout, lower performance and morale, and high turnover, all of which impede a health system's capacity to offer quality services. And because there's a dearth of gender disaggregated data or useful solutions, there's this misperception that these incidences aren't happening to the extent that they are, or aren't as serious as they really are, both of which denies or downplays the violence. And this undermines the skill, the compassion, and the unwavering dedication of these professional women. Not addressing violence in women healthcare workers, either deliberately or unknowingly, exacerbates long-term effects by invalidating their experiences and silencing their voices. Which is why my leadership project aims to amplify women healthcare workers' voices through the collective power of women leaders. So, building from and using best practices and strategies from another Women Leaders project from the 2022 cohort that measures, understands, and addresses safety in frontline healthcare workers in Zambia, my leadership project will continue to turn the dial from ideation to implementation. And in the process, I will develop a model to guide governments, programs, and civil service organizations to support frontline healthcare workers against workplace violence. Working with a brave, dynamic, and spirited team of women leaders in Zambia, we will provide a roadmap of the processes for engaging stakeholders, establishing stakeholder buy-in, pre-implementation assessments to undertake, guiding questions to ask, and best practices and lessons learned for collecting data and research on this sensitive issues that other countries can use. This model is timely. And this model is important because in 2019, the International Labor Organization Convention number 190 launched the first international treaty to recognize work-related violence and harassment. There's a push for governments to support ratification and implementation of C-190 in the coming years, but many countries are hesitant to do so because most often they don't know how to go about gathering such sensitive information. So this model will provide good practices needed to inform the operationalization of programs to advance this policy. Oof. Leading this safety and healthcare worker project is one of the most exciting and challenging projects that I've ever led in my division or even my tenure at CDC. When I started this journey, I had a completely different project in mind, but as I learned more about the leadership competencies that I would strengthen, I immediately realized that I could and really should lean into and leverage this project and use it as an opportunity to grow. Through this journey and through this project, I've learned to trust my abilities. And I've learned to recognize that my voice has power and that my voice has value. This journey has helped me to be more comfortable with change, and it's helped me to explore meaningful and sustainable connections with partners and also with colleagues. I've leaned into my strategic leadership a bit more, I'm being more strategic in how and when I leverage my power, how I leverage my voice, and how I leverage my position. All of which has led the charge in securing funding to apply this work beyond Zambia, for which another woman leader in our division will launch. So, through this collective power of women leaders, we will continue to prioritize the safety and well-being of women frontline healthcare workers. I want to thank these wonderful women leaders, Dr. Choe Jacobs, and my 2023 cohort members for always being my cheerleader, my sounding board, my encouragement, and my support. Thank you.